Welcome back to A Toast to Health. Today we're diving deep into a topic that's close to my heart and crucial for the future of healthcare: the importance of provider satisfaction. So grab your favorite healthy drink and let's raise a toast to happy healthcare providers. First off, let's define what we mean by provider satisfaction. It's not just about doctors and nurses having a good day at work. It's about creating an environment where healthcare professionals feel valued, supported, and able to deliver the best possible care to their patients. It's about building a healthcare system that works for everyone, providers and patients alike. Now, you might be thinking, why should I care whether my doctor is satisfied with their job? Well, let me tell you, it matters more than you might think. Provider satisfaction isn't just a nice to have, it's a critical component of high quality healthcare. Let's break down why. Firstly, satisfied providers deliver better patient care. It's as simple as that. When healthcare professionals are happy in their work, they're more engaged, more attentive, and more likely to go the extra mile for their patients. Studies have shown a direct correlation between provider satisfaction and patient outcomes. Happy doctors and nurses tend to have patients who recover faster, experience fewer complications, and report higher satisfaction with their care. Secondly, provider satisfaction is crucial for retention and recruitment in healthcare organizations. We're facing a healthcare workforce crisis, with shortages in many areas of medicine. Organizations that prioritize provider satisfaction become magnets for top talent. They're able to retain experienced professionals and attract the brightest new graduates. This stability translates to better continuity of care for patients and reduced costs for healthcare systems. But what factors influence provider satisfaction? Let's dive into some key elements. Number 1, work-life balance. This is a big one, folks. Burnout is a real and serious issue in healthcare. Long hours, high-stress environments, and the emotional toll of caring for sick patients can take a huge toll on providers' mental and physical health. Organizations that promote work-life balance through flexible scheduling, adequate time off, and manageable workloads see significant improvements in provider satisfaction and overall well-being. Number 2, autonomy and decision-making power. Healthcare providers are highly trained professionals who want to have a say in how they practice. When they feel micromanaged or constrained by bureaucratic red tape, job satisfaction plummets. Giving providers a voice in organizational decisions and respecting their clinical judgment can greatly enhance their job satisfaction. Number 3, technology and administrative support. Nothing frustrates a provider more than spending more time on paperwork than patient care. Implementing efficient electronic health record systems and providing adequate administrative support can free up providers to focus on what they do best: treating patients. Number 4, professional development opportunities. Medicine is an ever-evolving field, and providers need to stay up to date with the latest advancements. Organizations that invest in continuing education and career advancement opportunities not only improve provider skills, but also show a commitment to their growth and success. Number 5, compensation and benefits. While not the only factor, fair compensation and comprehensive benefits packages are important for provider satisfaction. This includes not just salary, but also things like health insurance, retirement plans, and paid time off. Number 6, organizational culture. A positive work environment where providers feel respected, valued, and a part of a team can significantly impact job satisfaction. This includes fostering good relationships between administration and clinical staff, as well as among providers themselves. Now that we understand why provider satisfaction is important and what influences it, let's talk about some strategies healthcare organizations can use to improve it. Number 1, regular feedback and communication. Establishing open channels of communication between administration and providers is crucial. Regular surveys, town halls, and one-on-one meetings can help identify pain points and areas for improvement. It's not enough to just collect this feedback. Organizations need to act on it too. Number 2, invest in technology and support staff. By providing efficient tools and adequate support staff, organizations can reduce the administrative burden on providers, allowing them to focus more on patient care. Number 3, promote work-life balance. This could include flexible scheduling options, ensuring adequate staffing levels to prevent overwork, and providing resources for stress management and mental health support. Number 4, empowering providers. Give healthcare providers a seat at the table when it comes to organizational decision-making, especially for decisions that directly impact clinical practice. Number 5, recognize and reward excellence. Implement programs to recognize and reward providers who go above and beyond. This could be through formal award programs, public recognition, or even small perks like prime parking spots or extra time off. Number 6, invest in professional development. Provide opportunities for continuing education, attendance at conferences, and career advancement. This not only improves provider skills, but also shows a commitment to their long-term success. Number 7, foster a positive culture. Create a work environment that values teamwork, respect, and mutual support. This can include team building activities, mentorship programs, and initiatives to improve interdepartmental collaboration. Number 8, address burnout proactively. Implement programs to identify and address burnout before it becomes severe. This could include regular check-ins, providing resources for self-care, and creating a culture where it's okay to ask for help. Now, I know that some of you might be thinking, this all sounds great, but isn't it expensive? Won't it cut into the bottom line? And that's a fair question. Implementing these strategies does require investment, both in terms of time and resources. But here's the thing, the cost of not addressing provider satisfaction is far higher. Think about it. High turnover rates mean constantly recruiting and training new staff, which is expensive. Burnout leads to decreased productivity and increased medical errors, which can result in costly lawsuits. And unhappy providers often lead to unhappy patients, which can impact an organization's reputation and patient retention rates. In contrast, investing in provider satisfaction can lead to improved patient outcomes, higher patient satisfaction scores, better staff retention, and ultimately, a stronger, more resilient healthcare organization. So let's raise a glass to provider satisfaction. It's not just about making doctors and nurses happier, although that's certainly important. It's about creating a healthcare system that works better for everyone. It's about recognizing that the well-being of our healthcare providers is intrinsically linked to the well-being of our patients and our communities. As patients and members of the community, we can play a role too. Show appreciation for your healthcare providers. Advocate for policies that support their well-being. And remember, behind every stethoscope, every surgical mask, every pair of scrubs is a human being deserving of respect, support, and job satisfaction. I hope this discussion has given you a new perspective on the importance of provider satisfaction in healthcare. If you found this video helpful, don't forget to give it a thumbs up and hit that subscribe button. And remember, here at A Toast to Health, we're always serving up fresh insights on healthcare management. Until next time, stay healthy, stay informed, and keep toasting to better healthcare.